Um, Sorry. Yes. Uh, I think, yeah, people still joining, but it's already the time. So, welcome everyone. I hope you can hear as well. Those who are among the participants of the webinar. And before we start, I would like to remind you that we have translation into Russian, Spanish, French, Portuguese, and Arabic. And Arabic is on the Japanese channel. Sorry for that. And so if you need translation, please go to the relevant channel for the translation. And also a warning that we're recording this webinar, so we can share the recording and materials with those who registered but no was not able to join the webinar for some reasons. Yeah, good morning, good afternoon, good evening, depending on what part of the world you are at the moment. So we're starting this webinar, and I would like to welcome you to it. And the webinar is titled Powering Impact, Meaningful Community Engagement in Global Fund Grant Implementation and Oversight. So this is this is the first webinar of a series of webinars to be organized jointly by Global Fund Regional Learning Hubs. And for those who doesn't know what is the learning hubs, there are 6 regional learning hubs covering relevant regions of the world, like Anglophone Africa, Asia Pacific, ECA, Francophone Africa, LAC, and MENA. And this work is the work of this learning hubs is being supported by the Global Fund, and they are aimed to ensure the meaningful engagement of communities and civil society into Global Fund-related processes by providing them with access to needed information, knowledge, and technical support. So my name is Ivan Vorintsov. I'm the coordinator of the ECA Learning Hub, which is hosted by the Eurasian Harm Reduction Association, and I'm based in Vilnius, Lithuania, and I will be helping with facilitation of this webinar today. Yeah, the aim of this webinar is actually to help civil society and communities to become better engaged into the Global Fund grant cycle, and particularly its implementation stage, with a focus on the oversight processes. And today we have 4 speakers with us, so we'll have 4 presentations. We have colleagues from the Global Fund and also from civil society. From the Global Fund, we have Jill Cesari, Fund Portfolio Manager, and also Ed Ngoksin, who is a Senior Technical Coordinator at the CRG team. And on behalf of civil society, we have Oksana Rukshiniano, who is the director of civil society of Moldova Against TB, and she's also a CCM member. And also we have with us Hamidou Oedraogo, who is the National Executive Director of RAMI from Burkina Faso. And before we start with presentations, brief overview of the structure of the webinar and its timing. So as I already said, we will have 4 presentations. We will start with kind of theoretical part. Colleagues from the Global Fund will present on what actually is the grant implementation stage of the Global Fund cycle, and what role the oversight of the grant implementation plays in it, and so what are the vision of the Global Fund and expectations with regard to the community engagement at this stage. And after this kind of theoretical part, we will move to the best practices and lessons learned from countries. So we will have presentation from Moldova on the involvement of civil society and communities into oversight, or into CCM oversight, and also presentation from Burkina Faso on how using CLM could improve grant impact and implementation. Yeah, and we will try to fit into 2 hours. Maybe even we will manage to do it quicker. So that's it from my side, I believe. And we'll stop sharing the slide. And now I would like to give a floor to our first speaker, Gilles Cesare from the Global Fund, who will enlighten us about the global vision of the community engagement into the Global Fund grant implementation. Gilles, the floor is yours. You can, yeah.
Thank you very much. Thank you for the introduction. Hi, everyone. Nice to see so many of you, almost 300 people in this webinar today. So I'm very pleased. While I'm waiting for the slides to be shared, just a few words. So my name is Gilles Cesari. I'm a fund portfolio manager, the Southern Africa team, currently working in the Burundi country team. And I'm going to try to focus on the grant implementation and how communities can be engaged during that phase of the grant life cycle. So next slide, please. Perfect. So this slide is really showing us the grant life cycle in its entirety, as you can see. Just to note that the graph is not really at scale. Typically, the grant implementation in orange is over a period of 3 years, and the application with the grant making that you see in blue and purple is taking in average 7 to 8 months, and it happens the year before the start of the implementation. And then we have the closure period in pink, which is generally for about 6 months, and it happens the year after the last year of implementation. So this slide is really just to say that the implementation phase in the grant lifecycle is really the longest, and therefore we believe it's really key for community engagement. Next slide, please. So what happens during the implementation phase? The Global Fund is a donor, as you know, and as a donor, of course, our job is to disburse funds to the principal recipients. So the disbursement of funds is one of the key activities during implementation phase, because without any funds disbursed, of course, there are no interventions which can be implemented. As a donor, and like any donor, the Global Fund also expects, principal recipients and the country coordinating mechanisms, the CCMs in short, to provide data on what they have achieved, both in terms of programmatic targets, but also financial absorption. And we try to be a very agile donor. And so the Global Fund is constantly working with principal recipients, with the sub-recipients, and with the country coordinating mechanisms to adjust the existing grants. We call this, sometimes you will hear about grant revisions, sometimes it's referred to as reprogramming. But basically, the idea is to have this very agile way of using these grants to maximize the use of the limited resources we all have and increase the impact. Next slide, please. So the tools that we use for reporting are the progress update and disbursement request. So it's called PU or PUDR for the acronyms. And they are usually sent by the principal recipients every 6 months for large and very large allocations. And we also have the pulse checks and the spot checks. From those, the Global Fund, the CCM, the country coordinating mechanism, the CCM, the principal recipients get a performance rating of the grant, including results on specific targets. Example, the number of people living with HIV, we received their ART treatment during the last 6 months. The reporting period is important as it gives a great picture of the grant implementation, the successes, and the challenges as well. So community engagement is key here, because community-based organizations engaged in the response can share their results, obviously. The community-based organizations and communities can also ask questions directly to the principal recipient or through their CCM representatives on the underperforming indicators when the reporting is consolidated, for example. It can be a good time to share issues and propose solutions to improve the results for the next period. So the reporting period is really also a key step of the process where committees can be engaged. Ed is going to talk more about the role of community engagement in the oversight at CCMs, but just to note that the CCMs also must report on the materialization of co-financing from the government. This is something that we take very seriously at the Global Fund. And so here as well, community engagement is very, very important. National and local civil society organizations and community-based organizations are in first line when it comes to making the governments accountable. And so in countries where there is a community-led monitoring system in place, for example, and we will have a great example later about CLM and how to use data generated by CLM to improve results. The data generated by CLM can really, from that system, can be a formidable tool to advocate for the materialization of co-financing. Next slide, please. As mentioned earlier, the Global Fund is constantly working with the principal recipients, or PRs, and the CCMs to adjust the existing grants. So remember, we call them revisions or reprogramming. And the idea is really to maximize the use of limited resources and increase impact. There are several types of grant revisions, as shown on the slide. But the important point here is that it's one of the most critical moments of grant implementation. So this is the time where all stakeholders need to reflect on what was perhaps missed during grant making, or maybe some circumstances have changed. And so it's a step that makes it very crucial to adapt the interventions and the budget that principal recipients and all the stakeholders are using. Communities should be part of these revisions discussions, ideally. It can be either through the national program and the Ministry of Health, or through directly the principal recipients. Sometime maybe in your countries, there is also a community principal recipient. There are also very often community sub-recipients. You can also go through your representative at the CCM or meet with the Global Fund country team. For example, this is very personal, but for example, I meet with a large representation of civil society and communities during each mission, and we discuss a list of priorities, if you wish, to include in grant revisions. So not every priority will make it into the grant revision. This is very clear, just like it is as clear as well when it's, the grant making stage. But this will be very country specific. But I still encourage communities to find their allies to be heard during the discussions around grant revisions. Next slide. So to help with discussion during grant revisions, I wanted to remind you of the new annex, which was included for the first time during the grant cycle 7 funding request. For most countries, that was 2 years ago. The annex of funding priorities of civil society and communities most affected by HIV, TB, and malaria. This is a very good document to refer to, as it contains interventions or activities which may or may have not yet been included in the current grants. But these activities, including this annex, already made consensus at the time of submission during the funding request process. However, you do not have to be limited to the activities included in this annex. During implementation, like I mentioned, you may have noticed that something was completely missing from the picture, or something is just not working as an intervention. And so you want to propose also how to fix it during implementation. In any case, your CCM community and civil society representative should be engaged and should be engaging you as well in the discussions on the oversight and revisions during grant implementation. You can read more on this in the community engagement, a guide to opportunities throughout the grant life cycle, and the link will be in the presentation. Next slide, please. So here is like a completely non-exhaustive list of ways to engage during grant implementation. Request and use the results of grants, programmatic performance, financial performance. This is key. This is basically how we drive towards success, right? So use this, request and use the results of the grants, performance, financial and programmatic. Meeting with the Global Fund country team to share your strategic solutions to existing gaps in the response. Keeping a permanent communication channel open with your principal recipients, with your CCM, and at the CCM, especially through your representative and or also through other allies at the CCM. Update your annex of communities priorities to have a list of already pre-agreed interventions which you can use and can be suggested, whenever there are savings during implementation, so that you get ready to the table when there is a discussion on how to use savings, how to proceed with a grant revision. And also engage with the government on co-financing. The Global Fund grants will never cover all the needs. We all know that. Domestic financing is very, very crucial, and community engagement is really key here as well. Next slide, please. So finally, for your reference, you will find here a recording of the webinar organized by Input in June 2024. And this webinar was focusing on how you can make your voice count during grant revisions. So I really encourage you to have a look. Again, community engagement will be very country specific. So I'm not pretending to give ideas or solutions or tips, that will apply to any country. It's very country specific, even sometimes community specific, but we can really all learn from each other. So I really urge you to be engaged during this phase of the grant life cycle. And with that, I thank you, and I think I hand over to Ed. Thank you.
Great. Thank you so much, Jill. Let me see if I can try to project my screen.
Thank you, Jill. Yeah. Ed, now the floor is yours. And after Ed's presentation, we will have a 10 minutes Q&A session when participants will be able to ask those questions they may have on the materials being presented. Ed, please.
Great. Thank you so much, Ivan. And I'm happy to take on the second part of theoretical session, as you call it. It's great to be able to connect with colleagues. And again, for those who I don't have yet opportunity to meet, my name is Ed Ngok-Sind, and I work in the CIG department. So my presentation builds on what you already spoke to about the grant implementations, with the focus on the oversight function of the CCM, particularly the role of the oversight committee in this process. So in the next 10 minutes, I'll try to provide you with a basic overview of the CCM oversight as part of our policy and guidance, and that will follow with the concrete examples, which I think is quite an excellent model for engagement during this period. I would also, before I go into the presentation, acknowledge that the colleagues from the CTM Hub has joined as well. Yaroslava, who is a subject matter expert on this topic. Without further ado, as a quick reminder to all of you, and I'm sure you're already well familiar with it, the CCM plays a crucial role in the oversights, right? Focusing on various aspects, including financial, programmatic, and management aspect of the grants, and ensuring that the implementation of Global Fund supported programs contribute to national health response. The core principle here of the oversight is looking at a high-level elements and ensure that resources are being efficiently and effectively implemented and spent. It's a different kind of exercise from the grant monitoring function, which usually is performed by the principal recipient. Nevertheless, the oversight functions help the principal recipients to identify some of the key bottlenecks and make sure that grant is impactfully implemented. The oversight function is one of the 6 CCM eligibility requirements as per the Global Fund policy that the CCM needs to comply. Usually, CCMs would establish a subcommittee called CCM Oversight Committee to help plan, coordinate, and implement the oversight activities. Typically, these CCM's Oversight Committee is not a decision-making body, but is a committee that makes recommendations back to the CCMs as a whole for decision-making. And this Oversight Committee usually supports the principal recipient to translate the adopted actions to improve program. By design, the Oversight Committee should be nominated and elected by other CCM members through a voting process in accordance with the CCM bylaw. It usually is comprised of technical experts from governments, civil society, including representatives from key population and all people living with the diseases. The engagement of civil society and community representative here is very important because the group programs of the Global Fund funds usually includes a focus on provision of services at the community level. So we do believe that the CSO and community partners can provide an in-depth contextual understanding to the performance data, which is a critical information to have. And this is usually, this slide usually kind of illustrate a basic process for oversights, right? It includes collecting information, analyzing the data, recommending action, and then follow up on the results. And what you can see here is the example that we drawn from Ghana CCM that kind of provide step-by-step process of the cycle of how the oversight activities being implemented. First, the PR would submit the work plans, performance framework, a dashboard, if you remember the acronym PU that you mentioned, progress update and disbursement request, audits, and other reports if available. And that include assessment of other programs as well, right, that become available, as well as the data analysis that are made available through the community-led monitoring. The CCM Secretariat then requests additional information as relevant. The Oversight Committee then review this information, identifying the issues, and select some actions. Very often, that includes conducting the site visits as part of the ad hoc activities or routine to complement the insight before the CCM Oversight Committee submit a finding and recommendation to the fuller CCM. Then the CCM meeting takes place. They discuss and decide on possible actions, and then it's a responsibility of the CCM Secretariat and Oversight Committee to ensure that these actions are implemented and reported back to the CCM more broadly. So pretty much straightforward, right, in terms of how the process should work. Also, in terms of the oversight visits, I think it's really important to highlight that it has to be done properly. We have instances where we recognize that the oversight visits really help us to understand the reasons behind poorly performing area of the program. We have examples of a CCM Oversight Committee that conducted additional analysis to understand why prevention program is not working well or not accessible for people who use drugs. There was some insight that really point out to changing of drug use patterns, which is one of the key reasons why the service is not being uptaken by the community. So I think the CCM oversight has some value and would provide a complementary insight for the CCM oversight to make a recommendation back to the CCM. The last two slides I have, which you can see here, is just to kind of remind you that on the compliance side, what the Global Fund Secretariat is monitoring is the oversight function being one of the CCM eligibility requirements. If you remember, CCM eligibility requirements 1 and 2 are set at the point of the funding request submission. But 3, 4, 5, 6, including the 3 ones shown here, is monitored across over the course of the grant implementation period. All CCMs must submit and follow the oversight plan for the Global Fund approved financing. And this plan has to include details on how oversight activities will engage a broad lens of stakeholders, including community and civil society. Very often, CCM oversight committee members conduct oversight visits, as I mentioned before, and these also need to be indicated in the plan. And finally, CCM hubs assess the effectiveness of CCM using a performance framework, which speaks to the oversight functions. Look at the three components is assessed on an annual basis and use the outcome of this assessment to inform the CCM secretariat and incorporate into the CCM funding decision. The questions include, does the oversight committee has a right membership in place? Does it have a strategy, right skill set, and also does it include a representation of key vulnerable population and or people with living with diseases? Second, it does ask a question about, does it use strategic information and analysis? Does it organize a consultation and site visits? Does it use CLM data when available as part of their deliberations? And lastly, it asks a question about, does it work effectively with PR to proactively identify and mitigate risk to programs here and assess and make sure that the follow-up action is being communicated back to the CCMs. So I think I'll stop here and look forward to the discussion. Thank you so much for your attention. These are additional resources in the presentation as well that will be shared after this webinar, where you can get yourself more familiarized with the CCM policies and guidance. Thanks, back to you.
Thank you, Ed, very much. And yes, we will share all the slides, the presentations, and the recordings, links for the recordings in different languages with all those who registered for this webinar. So you will receive this information. And yeah, thank you, Ed, and thank you, Jill. And this was how we called it, the first part of the webinar, theoretical kind of. So now we have a time for Q&A. So I see in the Q&A there is a Q&A option here in the Zoom where people already asked a lot of questions, and many of them were already answered as far as I see. So Jill, Ed, if you can go to this Q&A section and see those questions which were not answered yet. Or I think people, if they raise their hand, probably can provide the opportunity to speak up, and people can be able to ask their questions vocally. So people, please raise your hand, dear participants, if you have any questions on the presented material. So please raise your hand. I will try to give you a floor.
Sorry, in the meantime, maybe I'll just jump in on one of the questions. I think I answered already in writing, but just, for everyone. So there was a question on when are the grant revision happening? Is there like a specific timing for the grant revision? This can happen anytime as needed, right? So this is very important. It's not once a year, it's not twice a year, it's not once per grant, it's anytime as needed. Circumstances change at any time. You can have a big intervention that for some reason is not either, I don't know, like possible or necessary anymore to achieve your targets. So then suddenly you end up with, some savings on your grant. And of course, you want to immediately use the savings for something else, because we know that the need, the list of needs and priorities is long, right? And we could not include everything in the grant. So it's anytime. And how this is initiated, it's of course coordinated by the principal recipients, because at the end, it's the principal recipients who are accountable to the Global Fund in terms of how the funds are used, and also about the target, the performance, results. But it can be initiated by anyone, in the sense that if you are, in contact with your PR, you are maybe a sub-recipient, or you are a community PR, you can initiate at any time the discussion. So I think this is important to note. Thank you.
Thank you, Jill. And I see 3 hands, so I will take 3 questions from the audience, and then we will try to proceed with the next presentations after they will be responded. The first one, Antonio Coelho. You can talk. You can speak up, please. Antonio, can you speak? Can you speak?
I'm not getting a response.
Hello? Yeah, we can hear you.
Sim, pode falar. Ok, vou falar em português. Meu nome é Antônio Coelho.
My name is Antonio Coelho.
Eu sou integrante do
I
mecanismo
am
de coordenação nacional
part of
para Angola.
the coordinating
A
committee.
minha inquietação é
My concern
problema que
is with the problem of
mecanismos de
a
coordenação
number of
têm
coordination
em relação
mechanisms
às ações
have
de supervisão.
in terms of actions for the supervision, oversight,
Visão estratégica,
especially between the difference between strategic oversight, which our CCMs are doing,
Então eu queria saber
and and I would like to know from the speaker what is the big difference between strategic oversight and the monitoring actions that over.
Thank you. Thank you. I will take a couple of more questions, and then Ed and Jill will give a floor to Ed and Jill to respond. So we have the next one is the participant with the nick ONG AJSASB. Can you speak?
Muito boa tarde, eu sou Fernando
I see
Canhina.
your hand, please.
Good afternoon. My name is Fernando Gagnina.
Boa tarde, eu sou Fernando
Yeah,
Canhina,
we can hear you.
sou técnico da ANASO. Bem,
I am work with
achei
NASU.
interessante
I
perceber
saw
uma
this presentation very
como
important,
funciona a
very
revisão das
interesting,
subvenções.
and to learn
Nós
how
entendemos
this revision is
que
done.
algumas subvenções estão em curso, mas também eu queria perceber a quem
So I would like to
dirigir
understand
essa carta de revisão de subvenção, já
how
que
to whom do I
todo
address
envolvido
a communication for a revision request,
tem essa autonomia, como dizia o orador, de
seeing that
fazer
anybody can do this
de dar início
for a revision or to initiate a revision.
Então, queria saber a quem
So I would like to
dirigir
know
para o
to
efeito.
whom do I address a request for revision. Thank you.
Thank you. And the last question for now I will take from Sium Safal. Yeah, please speak. We
Yes,
can hear you.
thank you very much. I'm Paul from Cambodia. That is the Phone Palm. That is the network of people living with HIV and KP's network. The presentation is quite meaningful and also very important to the community. So as I observe the situation of the grant is very low, and I think that because of the community and the platform is quite separated. And I think for the community platform like HIV and TB or malaria, these three diseases from the community, if possible, we could integrate into one platform. It will be a very easy. It's like a one-stop service, and also can reduce the admin costs for the community. Also will be can be just one voice also. Yes, thank you.
Thank you. So I see other hands, but unfortunately we can't take all questions right now, but we will have a discussion part at the end after next two presentations. So please keep your hands up, or please type your questions in Q&A chat, and maybe they will be responded in written form. But now I will give a floor to Jill and Ed to be able to respond to those three comments, questions we received.
Ed, you want to start? Because I think they were mostly on the kind of oversight part at CCM.
Yeah, I can start. I can start
Yeah.
and then have
Okay, go ahead.
Thank you so much. Thank you for the question. So, on the question about the strategic oversight vis-a-vis grant monitoring, right? Very clear. For example, the role of local fund agents would be verifying whether the services that is said that will be delivered is delivered as planned, right? So that means looking at, a number of commodities that could be distributed by this implementer and see whether that's indeed in line with the plan that has been agreed with principal recipient between PR and SR. So I think that's an LFA verification process. The PR then monitored the performance of the program in different areas in line with the indicators that have been agreed with the Global Fund. For example, if in this quarter the bed nets would be distributed to, let's say, 20 households in its district, and the PR would look at the indicator and to see, okay, well, 20 have been distributed. It means it's good performance. And then the strategic oversight of the CCM oversight would look more into the issues around, for instance, assessing whether the approach for delivering through the mobile clinics, through a static site of HIV prevention services, are they still effective? And if not effective, why? So it's going to be a little bit one level higher. But with all of that, it's a responsibility of the CCM to make sure that they have the access to information and also look at them and make sure that the recommendation is getting back to the PR for implementation for the oversight committee. So I hope I have responded to your questions. The second one, I think in the chat that my colleague has flagged to me is a question from Irvin, if there are any mechanism or guidelines within the CCM, within the Global Fund framework to allow principal recipient or sub-recipient to formally engage with civil society organizations. As you mentioned, the legal obligation that we do have, right, is between the Global Fund as an institution and principal recipients. Then the principal recipients, in line with the criteria developed by the CCM, select and recruit sub-recipients and sub-recipients and organizations who are meeting the criteria and well positioned to deliver on this task. Sometimes we could see that because of the nature of the programs, the sub-recipients really look specifically at sub-recipients who could be peer support groups who even not organized yet. And we do have the collection of some of these examples in the implementation guidance handbook, which we published in GC7 to outline in what setting, what organization could be well placed to perform which role, and what are some of the considerations there, which may include working to ensure that we have a flexible reporting requirement or making the financial requirements more flexible to allow for different type of organization to be part of the implementation structure. So, but we recognize that this is a challenging area for many of the settings where we do know that community organizations have limited capacity and challenge and a lot of challenges to meet the criteria that is set by the CCM. But we, as an organization, do not have a policy to override the country level selection of the SR and SSRs. I'll stop here and hand it over to Jill.
Yeah,
Thanks.
thank you, Ed.
Thank you. Yeah, thank you. So I think I'm just going to respond on the question on who can initiate the grant revision process. So on this one, it's not an easy answer because anyone can initiate the discussion in the sense that it can be the government that goes to the CCM or the PR and say, hey, we had planned to procure 20% of the bed nets for this year, but we can actually procure 40% of the bed nets for this year. So it's good news. So then, you are making savings on the grant. So we need to reprogram. We need to do a grant revision to use, these savings for other activities. It can be civil society who come with their community-led monitoring data and say, hey, in that district, this is not working, and this is why. And we know why, and we have documented, and this is the reason. So we need to adapt the response in that district to maximize the impact, and to get better performance. It can be, of course, but so anyone really of the partnership can initiate the discussion but the revision itself is between the PR and the CCM, because the CCM are engaged and need to validate, and the Global Fund, right? So, but it can be really initiated by any stakeholder of the partnership, really, any partner. So it's important that you keep your communication channel open with the PRs, with the national program, with your representative at the CCM. And whenever you really feel that there is a need to adjust, there is a need to change something, to really make the case, and so that it's brought up to the attention of the PR, and the PR, of course, the intention of the PR is to have the best absorption of their grant and the best performance. So anything that you are going to contribute that is going in that direction is going to be a yes, should be a yes for the PR. And then we engage with the PR from the country team perspective. Thank you.
Thank you, Jill, for your response. And thank you, Ed, once again. Now I suggest we move forward, but we will have more time for questions after next two presentations. And we'll have more speakers to address those questions. Now we're kind of moving to the, let's call it the practical part, or best practices and lessons learned from practical experience of civil society on the ground. And the first presentation will be from Moldova. So my colleague Oksana Rupciano from Moldova, director of the Civil Society of Moldova Against TB, and who is the CCM member and the member of the Oversight Committee in Moldova. She will present on how actually engaging with CCM to improve oversight of grant implementation happens in practice in Moldova, and how civil society is being engaged there, and what are the kind of successes. So, Oksana, the floor is yours. You're muted, probably.
Thank you, Ivan.
Yeah,
thank you, everyone, for joining. I hope you hear me well.
Yes.
Thank you.
Yes.
Yeah, I'm very happy to participate and give the practical part of this approach and engaging in oversight, because we all understand how complex all the processes regarding the oversight in the countries are implemented, and we saw it very, very relevant by Ed showing all the stages and all the complexities. So how it happens in the country. I would say that's quite challenging. It's easy. It's always easy to say, but it's difficult to do. First of all, as a country and as an active civil society, community representative of a country, we need to ensure that we have a chair at the table discussing these processes in the country. As in any country which is supported by the Global Fund resources, we do have a country coordinating mechanism, and I consider from the perspective of civil society and communities that it is quite good and is quite representative of civil society, as we are having up to 30% of people coming from the communities, affected populations, and civil society organization providing services, having quite a good part of the share in all this table in giving feedback and conclusions and expectations of what we consider as a equitable and inclusive oversight dialogue. In the country, as well as in any other country, we're speaking about oversight committee, which as well includes two representatives, one from the civil society and one from the community. In this committee in the country, we call it National Committee and Experts, and it is twice as important to see a community there considered to be by the Ministry of Health as an expert at the level of the country. Beyond all the procedures which reflect the operations of the country coordinating mechanism, we developed and we ask for it to have a kind of manual which will guide and help navigate communities and civil society through their own perspective. We have a manual developed in 2021 which speaks about the rotation, designation, election of communities and civil society in this board because we want it to be very inclusive. We have terms of reference which are quite technical, but we as civil society and communities strive a lot to increase our knowledge, to be participating there meaningfully and give relevant feedback. Therefore, people who are there should be, in a way, community, but in the same time to be rather technically and well equipped to give those feedback which are expected by the people who are participating in and are members of a community of the country coordinating mechanism. Speaking about practical approaches, how it happens, the CCM level is supported as well by the technical working groups, which are 3 in the number. And you can see on the slide that, and what we managed is actually to have the secretariat in all of these 3 technical working groups. We're having TB technical working groups, HIV technical working groups, and the third one is TB and HIV mixed technical working group to be supported by, again, by the representative of civil society and communities. And I think that's a good result obtained to be recognized at the level of communities that actually civil society and community representatives can hold this role in being and providing support to the president of the technical working group, which is actually a national TB program coordinators for both TB and HIV programs, and at the level of the technical and HIV mixed group, the representative of the Ministry of Health. The other good point, what we strive for, and we think that it's very encouraging for people, is to be supported by the country coordinating mechanism in facilitating a kind of pre-meetings which are implemented or take place behind the meetings of the national coordinating committee and the oversight committee, because we do want to collect all the feedback to adapt timely the responses when they are need to adapt it, to give feedback when there are savings within the implemented resources, so that we use the savings in a very understandable and equitable manner across both diseases, for example. So I think it's the other point which is important is not actually having all these pre-meetings, is to, so after discussing the documents, and we're speaking about dashboards, reports, PPTs among civil society and community affected populations, to come with suggestions, which we actually formulate in a kind of community position papers, where we ask for different clarifications, whether we have suggestions to improve the process, so that we recognize in that way that the feedback which comes is actually not only heard, but taken into consideration when adapting the policies. Positive results, what we managed to achieve is actually we know everyone who is engaged in an oversight process knows how difficult it is actually to understand a dashboard. It's a huge Excel files of different pages, and just imagine a community representative or civil society who had never worked with these documents navigating this complexity. So definitely it's not that easy. That's why, as one of our suggestions actually would be to have a kind of explanatory note, information note, to be submitted together with the dashboard, and which will facilitate the process of understanding of all those data, not just figures, but to be supported with percentage of implementations, to have the implementer as well of activities, because beyond every figure, there are number of activities, sub-activities, which need to be understood how they are incorporate in the overall program TB or HIV program implementation in the country. Another important point that we raised, I think, for 2 years, and we are happy to see it implemented, is actually to have and to discuss at the level of country coordinating mechanism, not only the project of the Global Fund implementations, but to have the NTP who is integrating the Global Fund project into the country overall image. And this is what we wanted to see. We don't want just to see the results of the Global Fund project. We want to see the overall response of the country, so that we can adapt, align all the strategies within the country. And this happens already for the second year, having after the representation of the principal recipient coming with the results for the part of those responses which are funded by the Global Fund, having the NTP coordinators for both programs, TB and HIV, coming with the overall strategic image of the response in the country. And I think that's incredible, positive and a good result in the country. Another point, and I think it's relevant, is having within all these high-level meetings to have the voices of the civil society heard again. And we are presenting the community perspective related to the oversight processes during those meetings. Another good point is actually, and we spoke about how important it is to consider the community-led monitoring data. And again, at the end of the last year, we developed, with the support of the Global Fund, the CCM community-led monitoring tool, which we will start using this year to see how many of those decisions to change or adapt or transform has been taken into consideration, so that we have practical results of what we are proposing and what is taken into consideration at the relevant points of project implementation. Key challenges, I think I already partially mentioned when we are speaking about the complexity. It's easy to say, but hard to do. And the different levels of knowledge, there are different levels of communities of different knowledge and understanding. So time is a very important point to be considered very seriously. If you want communities and civil society to participate and give relevant feedback, we need to give them proper time and proper guidance, I would say, to navigate through all those processes. And of course, the communities are very different. We're always challenging somehow, because the governmental structure, the partners are expected to us as community to come with a joint voice. It's not necessary to happen because the communities are so diverse. And it may happen that we have different voices, and the governmental structure and partners should acknowledge that we as communities are different, the issues are different, and we need to, but what is important is to have this compromise achieved in the country. Lessons learned and recommendation, of course, civil society and communities are important. We need to ensure and maintain this meaningful participation. We need to ensure and have these simplified tools. If you want to have a feedback, we need to consider this second part, an additional work for all of us to do in the countries. Detailed intervention, we need to understand all the detail, because if we are not understanding the details, we will never be able to come with feedback in a manner that the technical partners are expected from the communities. There are a lot of consultancies, studies. That's another point that we insisted to have it presented at the level of country coordination mechanism and at this high-level table. Integrated reported, what I said, it's important to see the results of the overall results in a country. And if there is other donors beyond Global Fund, it is important for the NTP to come with this integrated vision of what is going on, what is supported, because it helps a lot in transparency and in eliminating this overlapping which may come, and we just spend the resources not in the way they need to be done. Community-led monitoring is something which should be taken into consideration. And of course, time. I would definitely say that time is a point which is never enough for now, but we need to plan in a manner that communities and civil society have time to go through the oversight reports, to see the reports and to give their feedback. And what should be very important is for the governmental structures and for the partners to hear the voices of the civil society and communities. Thank you so much. That's it. Just to remind all of you that we are approaching the World TB Day, and we need to continue to commit, invest, and deliver, and help civil society play their role, meaningful role, once they are equitably equipped with knowledge. So I would say thank you so much.
Thank you so much, Oksana. So we heard now about how communities and civil society been involved into the CCM oversight, kind of, we can call it like kind of official oversight processes, yeah, in Moldova. And now from Eastern Europe, we will move to Francophone Africa and to Burkina Faso. And my colleague Hamidou Ouedraogo from RAME will present actually how community-led monitoring, CLM, could be used also as an oversight instrument to contribute to the improving the grant implementation and impact. Hamidou, the floor is yours. I believe Hamidou will, the slides will be in English, but Hamidou will speak in French. Hamidou?
Oui, est-ce que vous m'entendez?
Yes, can you hear me, Ivan?
We don't see your slides yet. Will you be able to show your slide? Show your slides? Yeah.
Oui. Je partage le diapositive. Est-ce que vous
So
voyez
I will.
maintenant?
Can you now see my slides? All right, now we can see.
So yeah, please proceed.
Est-ce que... Ok, merci beaucoup
All right, thank you, everyone. I'm very happy to share our experiences with you. After what has already been covered, Amidou Ouedraogo, National Executive Director for RAME, which is a civil society organization in Burkina Faso, and RAME is also the host of the Learning Hub for Francophone Africa. So here I will present how through community-led monitoring, we contributed to the improvement of Global Fund grants. And we took an example on viral loads in Burkina Faso, which is an important indicator for the grants and also for the country. And with the commitment of Burkina Faso to reach 95% of undetectable viral load by 2026, viral load testing was made free in all the platform, and that with the support of Global Fund. Unfortunately, we have challenges because the people whose viral load is undetectable was 37.6% in 2021, and those who were in ARV were plus 90%. So there was a deep gap. And for this, a national committee was put in place for the monitoring of plasma viral load. And a question was raised on how CLM can contribute to monitor and contribute so that we can reach the target set for 2026. So this is a declaration of one of the permanent secretary of the fight against HIV in Burkina Faso. It is the organization that coordinates all the different action against HIV. And he declared that the coverage of plasma viral load testing is low despite all the different platform contribution at the health point care. So it's a very big challenge. In terms of community-led monitoring, how do we proceed? We have in our different health district in Burkina Faso, we have collectors who are in patient organization, people living with, or organization of people living with HIV, and those data collectors have electronic devices for data collect through Kobo Collect, and they collect data every quarter with specific indicators on plasmatic viral load and other indicators, because we cover more than HIV. And those data are sent to a platform that RAME put in place at the national level. Those data are analyzed and sent back to the service centers for visibility. And those data are also transformed into a quarterly report that we share with the different organizations and institutions at the national level. So we send send it to the PR and also FASO Development Communautaire, which is the SEO civil society organization PR, and we also share it with national organization on the availability of product, the satisfaction of health service users, challenges that health service users meet, and also the case of payment, because different exam or testing for plasma viral are free. So we also produce report on the level of freeness, and we also send a report to the CCM. And at the PR level, we have public and CSOs PR. We share the report for actions, and we also share the data with technical partners as Global Fund, USA, SAIDS, and other partners. Based on the report and data that we generate, we try to start advocacy at different level. And for those advocacy, we try to see, because there are some challenges that are operational. So above, you will see a picture of meeting that we organize in a health center to present data of this district, to see how some of the challenges can be addressed at the local level. Now, anything that is not resolved at the national level, we transfer them to the central level. And there you see that we had a meeting with the national program for the fight against HIV, which is responsible of HIV questions. So we had a meeting with them to present the results and also see with them how we can address those challenges and also the recommendation. And we also had a meeting with the National Committee for the management of health products. And we have a platform where we present all the different products for the fight against HIV, malaria, and TB. And we discuss also with them what can be done, what is the situation in the distribution centers, what are the situation at the stock level, and RAME present the situation at the distribution, and also data on the satisfaction of users is an important platform for advocacy. And I also had a meeting with CAMED, which is responsible for the management and the provision of more than 60% of health product to the national. So CAMEG is responsible for the provision of medicine to testing product, and also testing material for plasma viral examining. And what can we share as results? With regard to all the aspects of activities, productions of proof, and also the contribution of other CSOs, we were able to get the recognition of the impact of informal testing on non-achievement of viral load indicators. Because when we say viral load, there are other testing that take into account creatinine, So we have diabetes and other tests that are associated, and it sometimes make the testing very expensive, and sometimes lead to some users not going to the health centers for those testing. And so we recommended that those testing, additional testing, be also taken into account. We were also able to get the adoptions of a test for total free viral load testing without really considerations of the origins of the patient, because in the past, if you were not in the active file of Charles de Gaulle Hospital, you had to pay 10,000 CFA. But now it is free for every HIV patient, and they can have their testing for free. We were also able to obtain a presidential order in 2021 for the free provisions of other biological monitoring examination. We thought it was important for all to have this ministerial order, presidential order to help, and we are now monitoring for effective implementations of this governmental order. And we were also able to improve some indicators. You can see that people living with HIV who are up to date with their testing, it went from 72% in 2022 to 80% according to the observatory report. And also for PLHIV who did not, or let's say who paid their viral charge, passed from 21% to 3% who continue paying. We have still challenges, but we were able to reduce the number of people who continue paying. And one other important thing to mention is we moved from 15% of indetectable viral load to 63 in the country in 2023, and this is the last result that we obtained in terms of viral load. You can see that we contributed for a significant evolution of the testing of viral loads. Now, what are the challenges? What we can quickly mention is to maintain community engagement. It is not easy to enforce community-led monitoring. We need the community commitment. There's also the challenge of available human resources to produce quality data, because we need to triangulate data. We have to look for data in other documents. We should also analyze field data, and this require a certain level of technicality so we can do it. And we also need to have a structured advocacy, because up to now in most of the community-led monitoring we do punctual advocacy, but we need to have structural advocacy to have long-term change and contribute efficiently to the improvement of the impact of grants. And we also need to capitalize the effect and impact, and this is a general community challenge. We always have difficulty capitalizing community contribution. So at the CLM also we have that challenge. Now, what are the lessons that we learned? So for us in Burkina Faso, political commitment and the recognition of the CLM work was actually a factor of success, and this helped facilitate the implementation of our activities at all levels. Every year, the government produces a note that facilitate the implementation of community-led monitoring in Burkina Faso. We also have a good coordination between CLM and community for the implementations of grant, and this help in the adjustment of the performance of program, and this is also an important lesson. And we think that in addition to the importance of community-led monitoring and community engagement, it is still important to improve accountability and the recognitions of the need to finance CLM, because finding is something that we should always look for. In addition to the fact that we acknowledge the importance of CLM, there should also be a recognition of the need to finance them. There are two recommendations that are presented here for us. We need to have flexible financing mechanism so that CLMs can be flexible. CLM produced data, but they also need to adjust to local and global context. So need to understand that some conjunctural situations happen and need quick actions, and the grant of global funds sometimes do not help cover all unplanned situation. We also think that there's a need to strengthen the use of CLM data through scientific production, how to allow researchers to contribute for the improvement of the contributions of communities. So these are the recommendations that we have. Finally, this is an image of the strategic oversight responsible of CCM in Burkina Faso, who during a workshop said that the monitoring did by RAME is important for CCM, and this is why we were able to sign a collaboration convention with CCM Burkina Faso for the sharing of data produced, and they say they use the data produced by CLM for alerts, and also give feedback to a peer on the availabilities of some intrant on malaria and other health products. So this is generally what I wanted to share on the use of CLM for the improvement of the impact and the efficiency of the program of Global Fund. Thanks, Ivan, back to you.
Thank you, Hamidou. And I think it's a really good example of how the ground level initiative like CLM could be used by civil society and communities to not only to improve the grant implementation and to help the municipal recipient to achieve relevant indicators, but also to improve the access of communities to, in this case, to the viral load testing.
Ivan,
Yeah.
Hamidou, if you could
Hamidou,
stop
if you can
sharing your
stop
screen.
sharing the screen, would be great. Thank you. Yeah. So now we have time for more questions from the participants to the speakers. And I see there actually in the Q&A chat, there are a couple of questions to, I believe, like to Hamidou on his presentation. And yeah, to maybe also Global Fund colleagues would like to address some of those questions we still have in chat. And yeah, for the participants, so for the attendees, please raise your hand if you want to ask a question, and I will give the floor to you. Let's maybe deal with first with those questions we have in Q&A chat. Hamidou, colleagues, do you want to address some of them?
Oui,
Ivan,
excuse
yeah,
Ivan.
Hamidou, please.
All right, Ivan,
Yeah,
can I
sure,
comment?
please, yeah.
Oui, je vois qu'il y a un collègue de l'Ouganda.
So I can see that a Uganda colleague appreciated and asked a question on how we can maintain the CLM result without the funding from donors. So this is what we are doing in Burkina Faso with the community commitment, because CLM is not only focusing on collecting data, but also reinforcing community engagement for the response to other pathologies in general, and also for human rights questions. So for us, we need to really have the integrations of community monitoring in the functioning in the different activities of key population in the organization of and if there is that integration in services in the different perspective of the institutions, then there is a possibility that we can do community-led monitoring in a very flexible way without external support. The other thing that we developed in Burkina Faso is that we develop a tool that is available at the national level, and that is easily accessible, and that is also cheap because it is free for all users. And for that, we lead the and data collectors are the health service users, and they can send information to the platform without necessarily we having to go and pay. And this is also a strategy that we use to ensure that we make thing accessible and also reduce cost of services in link with the implementations of CLM. Thanks.
Thank you, Hamid, for your response. Colleagues, I don't see any hands from the attendees. Yeah, please raise your hands if you want to ask questions. So, Christian Lapazuma, I unmute you so you can ask a question.
Bonjour.
Yes, please.
Hello.
Bonjour,
we
j'espère que
can
vous
hear
me
you.
recevez. D'accord, je suis Christian
I am
Lakuzuma de la
Christian
RDA.
Lakuzu Zuma
Et je
from
voudrais féliciter
Central
Adolphe pour sa
Africa. I would like to
présentation.
congratulate
Et je
Amidou for
félicite
his
l'équipe d'avoir
presentation,
fait équipe
and I
avec
also
l'équipe
would like to
burkinabé.
acknowledge the
En fait, ma
different progress that
participation
we
est
see in
celle-ci.
Burkina
Si
Faso.
je comprends
So my
bien, au niveau
question
du
is,
Burkina,
in
ce
Burkina
sont des
Faso,
résultats
we
du
can see
CLM
that what is
qui
presented
sont
is the result of
transmis au niveau du
CLM,
CCM
and those
et
are
que le
transmitted
suivi
to
stratégique
CCM, and the
se
strategic
utilise de ça
of
pour
oversight.
ressortir tous
CCM
les
use it at
situations
the
d'étranglement
strategic
de
level,
données qui
so
ont
that
été présentées.
to address
Bien,
the
je n'ai
different
pas,
challenges
je n'ai pas
presented.
beaucoup
I'm not
d'informations
sure that
sur
I
ce.
understood how
Je
the
voulais
data are used
vraiment
at the
qu'on puisse
strategic
me
level.
donner un
Amidou,
éclaircissement
can you
là-dessus.
clarify how those data are used at the strategic
Merci
level?
beaucoup.
Thank you.
Thank you for your question. Thank you. Hamidou, before you respond, I will take another question we have from the attendee. Okay. Oh, the hand disappeared. Okay, Hamidou, maybe you can respond to these questions, and maybe more questions will come.
Christian pour cette question et Shadi a
Thanks, Christian, for the question, and I greet all the colleagues of Central Africa and all the friends there. Yes, this is the understanding. We send the data, community-led monitoring data, to the strategic monitoring committee of CCM, and that's why we have a collaboration convention with the strategic committee of CCM, so that CCM in at any time can have access to the data that we are producing, and so that they can also select the information that they need, and that can contribute to the preparation of their strategic oversight mission. And so it helps them have the data, and with the beneficiaries of the PR and other, they will be able to now go for verification mission on the field to see how things are definitely going, and mainly how why, for example, this gap is shared or I spot by the community-led monitoring, they will be able to identify actions that beneficiary can take to address the problem. So this is what we are doing in collaboration with CCM in Burkina Faso.
Thank you, Hamid, for your response. And we have another hand from Musa Saganogo. Please, I unmute you. You can ask your question. No, Musa? You are muted. Yeah. No, Musa Saganogo, can you hear me?
Ok, bonjour tout le monde. Hey.
Yeah.
Oui, oui, Amadou, comment ça va?
Please, you can ask a question.
Oh, je voulais juste savoir.
So I wanted to know the data of CLM and the data of strategic committee. Don't you think that there will be like a sort of overlap between the two data? And at the strategic oversight, there is maybe there is something that is not clear, because the strategic committee is larger at the grand implementation cycle, and at the CLM the focus is on community. So will there not be an overlap between data from the two monitoring? Thank you.
Thank you for your question, and we'll take another question from Fire Pascal Camano.
Bonjour à tous. Moi, c'est
Hello everyone. I am Fire Pascal. I'm responsible of strategic oversight CCM. Is muted.
You are muted. Can you? Yeah, please proceed.
Voilà, j'ai dit je suis le
So
responsable.
I was saying that I am responsible of strategic monitoring in Guinea for Global Fund. So the questions of overlap is there's no overlap, because CLM focus on community level actors, people who directly benefit from the grants. They will share information with CSO that are in the monitoring, and those informations are shared with the strategic committee, who are also members of CSOs. And based, oh, he's off. Yeah, I cannot hear him.
Can you proceed?
Une mission de suivi stratégique sur le terrain pour aller observer, corriger les imperfections auprès du PR ou du SA.
So the strategic committee will get the information from CLM. Hello. So the community-led monitoring is focused on the direct beneficiaries, and now what they shared is used at the strategic committee level, and from the strategic the community monitoring, we can get information from CSOs, and now plan a mission, a field mission, to have a better understanding of the grants in general, because the community-led monitoring focus more in direct beneficiaries, while strategic commentary focus more on routine. The strategic oversight is quarterly oversight. We don't go into details. We try to evaluate what is working and what is not working, and how it can be improved at the strategic level. Thank you.
Thank you, Faya. It seems it was kind of a response to previous question from Nomus, but I see Oksana want to add to the discussion as well, and maybe Hamido will join. Oksana, the floor is yours.
Thank you so much for the discussion, and I absolutely agree with those important issues raised about what we're doing with the CLM data collected by communities. I do think that's critically important, and there is a kind of gap in using this information. I think what is important to do at the country levels in any setting where we are working is to have this CLM framework, which is accepted and recognized, first of all, by the authorities, by the governments where we are working, because we are collecting data and we want that this data is used to inform the policies, to adapt and to make the policies better. Because no matter the oversight committee is a higher level, but oversight committee in the communities, we all work for our end users, for our patients, for our people. Because I think it's important, and what we are trying to do is to have this tracker, this accountability framework, and all those discussions that we are having within the spaces of the community-led monitoring data to be reflected in some meetings at the CLM level, because this is a high level. And if the issue has been were raised by the communities as something important, it should be, first of all, noted, and then communities should track whether people who are responsible to solve this issue have taken all the measures that this issue is settled down. Because, you know, why it is important? Because some issues are very easy to handle, some issues are very difficult to handle. But it is important that all of them are noted and all of them are settled with step-by-step actions, slowly, not leaving issues which are harder to be settled down because it's not time or it's not our problem. We need to find the issue. We need to find the people who are responsible, and we need to settle the issue. That's why, this is why the rationale of a community-led monitoring, we're doing it to inform and to adapt the policies, to have programmatic implementation of good interventions, and people who need our services benefit of those services, who meets their expectations. And I think that's an overall problem. And for communities who are doing community-led monitoring, beyond just reporting problem, they need to have a mechanism to see how those issues that have been reported are settled by those who are responsible. It may be authorities, it may be a doctor at the local level, healthcare, but the issue should be tracked and it should be settled down. Thank you.
Thank you, Oksana. Thank you, Oksana. Hamidu, let me know if you want to add to this discussion, or should we take questions from other people in line?
Thanks, Ivan. I think that the question of Sanugu is already addressed by Faisal from Guinea. That's exactly what I wanted to say. It should be noted that the data of CLM is another source of data for strategic monitoring of CCM. It is not the only source of data for the decisions of the strategic oversight of CCM. It is also an important source that help CCM understand and make a difference between what programs and health centers say and also what the communities and beneficiaries themselves say, and this help have like data to triangulate. I can also see that there is somebody who asked a question in the chat on how the CLM data are shared with the program, given that they are shared for the monitoring evaluation of CCM. Yes, CLM is not exclusively there for strategic monitoring of CCLM. CM. It is also produce data that are accessible to actors at the national level. That's why it is necessary to have a CLM that is well known a platform that is accepted by all the communities, and in Burkina we have a platform which is accepted. So when we share data with CCM, we also share the same specific data to each program of Global Fund, so that they can also know the different challenges that were shared with the implementations of grant, know, for example, the challenges, and we also formulate recommendation and how we can monitor the implementations of those recommendations for the improvement of the implementations of Global Fund grants. So it's not really exclusively. We don't share data only with CCM. We also share data with the different program of Global Fund and other partners. Thanks.
Thank you, Hamid, for adding to the discussion on that point. And now let's take a question from Annie Sampa. Annie?
Hello.
Hello. Yeah, we can hear you.
So I'm the oversight chair for the oversight committee for the country coordinating mechanism in Zambia. And my interest actually was to find out how data is transmitted from the community into the government systems from the people who presented. I think I missed that. And I also wanted to know whether there are parallel systems in collecting data and how, if yes, that is brought together, in one system. The reason I'm asking is because I also wanted to know whether we may have any leakages in terms of transmission of data. Is there any possibility of missing any of it as it is being transmitted? Thank you.
Thank you. And before answering Annie's question, I will take another question from Roberto.
Hi. I actually thank you very much. Very insightful discussion on community-led monitoring. I actually asked it in the chat. Is there any current or existing implementation of an integrated TB, HIV community-led monitoring elsewhere, and how are you guys doing it? Because that's something we in the Philippines that we are being asked to do right now. Any thoughts on integrating TB and HIV and CLM work? Thank you.
Thank you so much. Yes, Christina, Hamidu, do you want to respond to these two questions? And actually, as we have such a great discussion around CLM, I would like to let you know that the next joint webinar of the regional learning hubs actually will be on CLM. It will be led by the Francophone Learning Hub in April, I believe. Yeah, and so look for the announcement, and there will be it will be a very right place to continue the same discussion. But Hamidu, Christina, do you want to address comments, questions from Annie and Roberto? Oksana, Hamidu.
Okay, yes, I will say something before.
Okay. Merci beaucoup.
All right. Thank you for the questions of Roberto. You could contact Rame after, because in Burkina Faso we have an integrated CLM that cover TB, HIV, infantile health, and other aspects of health governance. So we have a CLM that is large and we can share more our experience and support you for the development of your CLM. For the question of Annie, I think that we already presented how we use, how we make a link between CLM and CCM. And I will maybe let Oksana come back on this point, mainly for community engagement. If not, in Burkina Faso, we have an experience. We try to work in collaboration with CCM to share data. Now, there are lots of data. We have a data treatment team, and we analyze the data before sharing it with the other partners like CCM and the implementing partners of the grant. So we we analyze all the data at our level. So if there is need of clarification, we ask for clarification to make sure we have credible data before sharing them with the other actors. Thank you.
Thank you, Hamidou. Oksana, do you want to add?
Yeah, I think that's critically important for countries to and for us as trying to use efficiently the community-led monitoring to have an algorithm. And this is what we do to be sure that the data we collect reaches the NTP and suggest those areas which need to improvement. There should be a framework, an algorithm, like step to step, what we do with the data. So that's a two-page document, I think, which should be developed very easily for those who are engaged in the CLM collection to follow like a kind of rules, because it's really important which data goes where, because we need to know that there are a lot of partners and there are a lot of levels of those who may address the issue. So that's important, one point. The second point about the integrated community-led monitoring system, it's very challenging because HIV community-led monitoring have actually been developed, have a kind of history. There are very different tools like React, Impact. In TB, this is something new, and I think that's challenge because they are done separately. I don't think if there are very good examples of integrated CLM tools, TB and HIV. But what is important to know, but there are tools which are very, very successful. So I think integrating a part of the indicators of data to be collected either on HIV or TB in one system is not very difficult, but it should be started at the countries. The other way is important whether the communities who are collecting are working in both fields, in TB and HIV. That's the other issue, because you can have the system, but if you do interact only with HIV groups and people affected by HIV, so you will definitely report only issues related to TB. So you need to have communities who interact with both groups, and this is the other challenge. So it depends, it may be different, but if there is countries which have access to all the beneficiaries, there should be absolutely a way to integrate those systems in one and to not to overlap efforts in, for example, in reporting double data into systems. That definitely should not happen. And if there is such an issue, it should be raised, and the systems should be unified in a better way, so that people who are collecting are not doing jobs twice, reporting in one system and the others. And I think that's critically important to be done. But it's country specific. It depends. It depends, definitely.
Thank you, Oksana. I will take three more questions from the audience, oral questions. But while I doing it, I see that there are a number of questions in chat. Maybe Global Fund colleagues want to address some of them. Jill, Ed, let me know if you want to address orally some of the questions in chat.
Great. I can try to address some of them. And lastly, they are programmatic, right, on the CLM, which I think will be touched upon in the next webinar. But just to highlight it, again, I think we recognize the challenges with sustainable funding for CLM. because it's largely funded by external donors such as the Global Fund or PEPFAR. But now with the reduced funding, I think we need to think about different ways of supporting this piece of work in a more sustainable manner. And we do see some of the example largely focused on community-based monitoring rather than community-led monitoring that have been taken on board through domestic financing. So I think if folks have examples of CLMs that have been, able to tap into non-external resources, I think it'd be good to really unpack them and see what makes it work. But the Global Fund commitment to supporting CLM remain unchanged. This is one of the priority area in GC7, as you already know, and we hope that we can fully leverage the investment in CLM to really, as Oksana mentioned, to address the local level issues, right? Engaging directly on service delivery, engage with doctors, changing the way the service is being provided, but also engage at the higher level, we call a longer feedback loop at the CCM, at the national program review, so that these insights go to inform course correction that the national program needs to take. Is CCM required for Global Fund to make the meeting minutes publicly available? I believe that perhaps Jaroslava can speak to it or respond in the chat. I do believe that we, as part of our support to the CCM Secretariat, we do monitor how the CCM Secretariat facilitate access to information for all stakeholders. So we do want to make sure that the information and minutes of the meetings are documented and made available on the CCM Secretariat website. And this, again, should also be the bylaws as part of the CCM policy. And CCM Hub is usually have these documents and review them to make sure they're in line with our policy and guidance. The possibility of integrating CLMs in countries, and I think this was raised before by Roberto. Roberto, I think because countries are in different places, right, in terms of how they implement the CLMs. Sometimes countries introduce various tools for CLMs for specific diseases. I think the directions is to see whether they could be better harmonized, at the same time protecting and allowing community to decide what indicators, what priorities are most important to document. But we do see in some of the high impact portfolios in Africa where there's platforms where all of the CLM implementers are brought together, look at different area of monitoring and see whether there could be a harmonized tool to look at HIV, TB, malaria. But we want to make sure that this conversation happens at the country level, that we don't, in the Secretariat, override what should be monitored, right? Because at the end of the day, we want to protect the community word in the community-led monitoring. That community need to be able to determine what's most important for them, and the harmonization process help to see where it makes sense. Again, the recommendations, which I do think we'll be discussing in the next webinar, would be to ask the countries to reflect on the tools they've been using, the possibility of harmonize, and how do we bring different communities together again to really leverage the use of CLM data. But we do acknowledge that the Global Fund being one of the key partners in supporting CLM, the PEPFAR has also been, and we are unsure of the directions where the PEPFAR will be taking in terms of their support to CLM. But in any case, I do think the criticality of this intervention will continue regardless of the external funding situation. I don't know if I have responded to everything, Ivan, but
yeah, thanks. Yeah, thank you, Ed. Yeah, maybe your colleagues can respond manually to some other questions. And so as we have 15 minutes left from the official time of the webinar, and I see 3 hands from participants. So I suggest I'll take these 3 questions, and then we will be wrapping up the webinar. So the first question will be from ONG AJSB. Sorry, this like difficult abbreviation. Yes, please, the floor is yours.
Obrigado. Sou Fernando Canhina, técnico
Yes,
de
please. We can
monitoria
hear you.
liderado
You
na
can-
comunidade da NAS. Bem, na verdade, eu achei interessante
So I found it very interesting,
e
the
quero já
various
parabenizar a belíssima
presentations, and I'd like
mas
to
eu queria
congratulate
entender um pouco sobre
everybody.
o critério desta monitoria liderada pela comunidade, porque em Angola também
But
temos
in Angola,
uma experiência que
we have an experiment that
financiamento do Fundo Global.
we have
Então, era
been carrying out
bom
for the past few years through global funding.
esta monitoria liderada pela comunidade
So
para se calhar vermos
it would
como é que se
be interesting
enquadra com a nossa modalidade aqui em Angola. É
to
muito
see
importante
how we could implement CLM, to see how this could work with the model that we are following at the moment, and to see if this would create a synergy, to see if one day we could have CLM and to be able to work on the same platform model as the other countries. Over.
Mhm. Thank you for the question. And I think you definitely can be in contact with Hamid, for example, after this webinar to learn more about how it's possible to implement such CLM projects. And the next question will be from Natalia Shestak. Natalia, the floor is yours. Natalia, can you hear me? Not sure if Natalia can hear me. We have a question from Joseph. Joseph, are you with us? Joseph, you need to unmute yourself.
Can you hear me now?
Okay, yeah, please.
Yeah, my name's Joseph Odongo Dog. I'm a member of KenPud, Kenya Network of People Who Use Drugs.
Joseph?
And I'm also the director of
Joseph, can you hear us?
You can hear me? Can you hear me?
I can hear him. We can hear him.
Yeah, I'm a member of
I don't hear the translation, although.
He's speaking in English.
Kenya Network of People Who Use Drugs,
Okay.
And I'm also the founder director of TEDA. This is True Education on Drugs Addiction, Malindi, Kenya. And my question was we do about the CCM. We do have our representation at the CCM level in Kenya. And I do understand the person representing us is acting as an alternate. And I wanted to know if our issues can be well addressed when the person representing the community is acting as an alternate at the CCM level. Another question is that we were part of the GC7 writing team as a community of people who use drugs in Kenya. But we proposed that the community was to have at least some diocese owned by the community-led organizations in Kenya. But when it came to the starting of the implementation, our proposals were scrapped out. So I don't know where the problem was. I wanted the Global Fund Secretariat to help us understand what's happening here, because we have never had a meaningful engagement with the PR or anybody else, and the community is willing to be part of the implementation and programming, so that at least some of our community-led organization can be part of the programming and to help lead in fight against HIV, TB, and malaria. I do, as a member of the community in Kenya, I do understand that we've been taken into circles when it comes to PWID-led organization programming for a long time, because we've been there since 2015, and there's not even one community-led organization in Kenya programming. We've been taken to a lot of trainings and all this kind of stuff for a long period, and the community is left behind when it comes to programming and doing other things concerning the PWD community.
Thank you, Joseph. Yeah, very clear point, and hope someone from Global Fund can be able to so help. But before allowing people from Global Fund to respond to questions, I will take one more question from Peter Aviti.
Yeah, thank you very much for this opportunity. And I really also resonate with David from Mombasa, and I'd written in the chat box. Now, my question is that who owns the data for CLM? Because in Kenya, where I come from, I am a community-based person. My organization is one of the counties. I've never implemented, but I have been in the Global Fund processes right from the rounds times until now. We have the CRs. And now the question is, when we started CLM, it was, as Nadem said, it was to be community-led. But then the government said, no, you can't ask us questions. We can't respond to issues that we are not part of. So they decided to influence the CLM. And when it comes to collecting data, people from outside the county are given opportunity to come and implement the CLM in the counties where they don't even speak the language of the people. And then when they collect the data, they go away with the data and share it only with the government or during the dialogue. The community does own the data so that they can continue monitoring, or they can continue, even if another SR comes, they have the cohorts. The data is taken away and the community are left. So they're just being used as guinea pigs for answering questions. How can we make the communities own the data that is collected about them? Thank you.
Thank you very much for your question. So as we have 5 minutes left till the end of the webinar, I probably will not take more questions for now, and give the opportunity to Global Fund colleagues or the panelists to answer those questions being asked. So we have a question from Angola, from Nigeria, Kenya, and so please maybe add or who would like to
Sure, I can take the question, but I don't think I have the answer. Just to acknowledge that the colleagues, I think we can make note of your comment here, and make sure that you're connected with the CRG advisors for the portfolios. For Kenya in particular, I know it's been challenging to get resources to the community-led organizations. So the challenges you have highlighted is well noted. Similarly, for the Angola and Mozambique, we have the dedicated advisor for the portfolio. And if you feel like you have challenges engaging in the country process, definitely would encourage you to get in touch with our colleague who is a focal point, and then we can explore what are the opportunities during grant implementations where we could think through better engagement approach. And if we need to intermediate and support engagement, I think we're happy to do so. Thanks.
Thank you. Yeah, and I think it would be great here to like take these questions and kind of link people with relevant Global Fund colleagues who can maybe intervene and support colleagues in countries. Yeah, unfortunately we're out of time, and I see we have more hands, but we can't keep our interpreters longer, and some speakers are already leaving because they need to switch to other meetings. So maybe just I would like to ask Global Fund colleagues to say some final words. I don't know, Ed or maybe Niluka, to wrap up the kind of to the webinar. Yeah, and once again, to those colleagues who have more questions on CLM, the next webinar will be particularly on CLM, and please join in April, and you will have a chance to participate in relevant discussions. Niluka?
Thank you, Ivan, and thank you everyone for your great participation in this webinar. Definitely we find that there's a lot of excitement and interest to engage in conversations around engaging as communities in Global Fund grant implementation and grant oversight. And what was very, very clear during this webinar is the excitement and the need to engage in CLM conversations. So as Ivan said, our next joint webinar, which is tentatively planned for May this year, and which will be organized by our Francophone Regional Learning Hub, which is hosted by Rame, where Hamidou came from, will be entirely on community-led monitoring. We are still figuring out among the learning hubs and with our colleagues in the Global Fund what should be the focus of this webinar, as CLM is quite a broad topic. So as soon as we have this information ready, and we will be promoting the webinar through the learning hub. So please keep an eye out for that, and please do join as you did today. We will bring our colleagues from the Global Fund also to engage in that conversation, not so much in terms of answering the questions, but to engage in a fruitful conversation with community colleagues on how we can use that platform to see CLM could be used in different ways to really push for community priorities within our grants. I would like to thank all the speakers, including our community speakers, Hamidou and Oksana, as well as Jill and Ed and Yaroslava, who were here providing presentations, but also answering questions on the chat. And to Ivan for organizing this first joint webinar, and for all our Learning Hub colleagues, as well as to the interpreters for their amazing work, switching between channels from English to their own languages. We really, really appreciate your support. Ivan, over to you.
Yeah, thank you, Niluka, and I also would like to thank everyone and the panelists, my colleagues from the Learning Hubs, for supporting me in organizing this webinar, our great interpreters, without whom we will not be able to organize such multi-language event. Yeah, and
perhaps
yes.
just everybody can turn on the cameras for a quick picture. That would be great.
Yes. Good idea. So who is able to turn their cameras, please turn your cameras. And Niluka, if you can make such a picture, would be great. Yeah.
Yeah.
So thank you. Sorry for those colleagues who still have questions, but they left unaddressed. Please join our next webinar. So, and please feel free to continue discussion by email, approaching me or Global Fund colleagues, so we will be able to respond to your questions by email. Yeah, probably that's it.
Thank you, everyone.
Finish and have a great day. Have a great week. See you next time.
I just wanted to say,
Let's see.
Yeah.